from the American Academy of Pediatrics.
It's that time of year again, respiratory season. If you're parents, you know what I mean. Runny noses, coughs, fevers, kids missing school, and parents scrambling to juggle it all. Today, we'll break down what to expect this respiratory season, which vaccines are recommended, and how you can keep your family healthy.
We see a lot of, in doing surveys and talking with families and things like that, we do hear a lot of reasons that, okay, why didn't I get the vaccine? One of the big ones is, well, the last time I got it, I got the flu. It gave me the flu. It doesn't actually give you the flu.
Right.
Now, some people can get some body aches. You might get a little fever, but that's not actually getting an active infection from the flu. For the most part, that's a sign that your immune system happens to be working pretty well that day, responding to the vaccine, and so then you're protected.
Welcome to Healthy Children, the podcast for parents from the American Academy of Pediatrics. I'm Dr. Edith Bracho-Sanchez. I am a pediatrician and a mama figuring it out. This is a judgment-free space where all questions are good questions and the answers will hopefully be even better. Let's get started. Today, I have with me Dr. Sean O'Leary, who is an infectious disease specialist and chair of the Committee on Infectious Diseases at the American Academy of Pediatrics. Who better to talk about respiratory season with? Sean, welcome.
Happy to be here.
Sean, where I trained, to get right into it, we used to call pediatrics a quote-unquote winter sport. We know, of course, that many viruses circulate in the winter when people spend more time inside together, including the big three, RSV, flu, and COVID-19. Are there, Sean, at any point, any indicators of how severe this upcoming season might be?
I think the only thing predictable about respiratory season is that it's unpredictable. We never really know. And for example, last influenza season was a relatively severe one for kids. But that doesn't mean we're going to have a less severe one this year. Sometimes we do see multiple years in a row where we have some severe flu seasons. So I think it remains to be seen. What we can predict is that all of these viruses will be around.
Right. That we know for sure. They will be here, and unfortunately, children will be catching them. Let's dive right into these three, Sean, if it's okay with you, starting with RSV. Many parents are familiar with it, but remind us again, what is RSV? And I think most importantly, why is it such a big deal for infants and young children?
Yeah, so RSV, it stands for respiratory syncytial virus, and any pediatrician can tell you all about RSV because when we train as pediatric residents, we see a lot of it, and it comes typically somewhere, maybe starts picking up around November, December, but then really gets more severe in January or February. And it's a very common virus, I should say. It's also one that almost all of us get almost every year. It's one of those colds, like as an adult, when you get it, it's one of those colds that, oh my gosh, I can't believe how many tissues I'm using. For the younger kids, though, because it's such a, what we call a mucus-producing virus, it becomes a real problem because for the younger kids, their airways are particularly small. So, for example, for the youngest infants, they are what we call obligate nose breathers. They mainly breathe through their nose. Even if they don't get it down into their lungs, which they often do, even if they don't, their nose gets so blocked up, sometimes they have to be hospitalized because there's so much mucus. The bigger issue, of course, is what we call lower respiratory tract infection, where the virus causes inflammation and then mucus production within the airways of the lungs. And the problem in these younger kids is those airways are really narrow. So imagine breathing through sort of a large tube. That's a lot easier than breathing through a tiny straw. And so for these younger kids, they have these tiny straws in their lungs that get plugged up with mucus. And so all of that is to say that RSV is actually the leading cause of hospitalization in young children.
Yeah. And, Sean, we always talk about, when I try to explain it to families, right, we talk about how small the airways are for tiny little babies, how they're obligate nose breathers, all of those things. I think something changes, at least in my mind, when you see a young child, a baby struggling to breathe with RSV. I mean, it's like it all just sort of comes together when you see it. It's like, oh goodness, you really are trying to breathe through your nose and you really can't. It's serious. And these videos, they circulate on social media every now and then. I think just to add to what you're saying, I just hope parents really take it seriously that we're talking about, their bodies and the physiology. But at the end of the day, it's like you're talking about a tiny, tiny baby who really will not be able to breathe very well. Part of the reason I'm so excited to talk to you about it, and yes, excited is the word, is that we now have a way to protect these young infants, right? So talk to us about the options for immunization for both pregnant mothers and young babies.
Sure. I mean, the good news on RSV is now we have products out there that can prevent it, and they're very safe and they're very effective. These products have been a long time coming. I want to do a quick tangent here and just go back to something you said at the top of the hour, the big three. You said influenza, RSV, and COVID-19. When I trained, the big three were influenza, RSV, and rotavirus.
Wow.
And then, so we would have a rotavirus season where we would just have tons of kids in the hospital with diarrheal disease. Now we have vaccines that protect kids from getting rotavirus. And so we don't have a rotavirus season anymore. The hope now is that same phenomenon is what we're going to see with RSV. And we have some population level data on that already because now we have these great products. So let me go into those products really quick. There is a vaccine that is recommended for use during pregnancy to be given between 32 and 36 weeks. And I should say, based on the data we have, these products appear to be essentially equally effective and equally safe. There are no safety concerns with either the vaccine given to pregnant women or the monoclonal antibody or immunization given to infants. They're both very safe, both very effective. And so this one is recommended to be given 32 to 36 weeks. If the baby is born less than 2 weeks after that vaccine is given, then it's also recommended that the baby get the infant immunization as well, because there wouldn't have been time to develop the immune response. That's, of course, relatively uncommon. So for most babies, they either need one or the other. So now, on the one hand, it's fantastic we have multiple products. On the other hand, it can be a little confusing for parents because now all of a sudden we went from having nothing to prevent RSV to now having multiple options for preventing RSV. I think they're both equally effective, and I think parents can decide, would they rather get the vaccine during pregnancy or give the immunization to the baby shortly after birth? So let me move into the immunization after birth. So it's a monoclonal antibody. And just let me get a little bit technical here. So it's technically not a vaccine. So a vaccine is something we would call active immunization. So our body gets exposed to like a tiny piece of a virus or something like that. Our body creates an immune response. And then the next time we see that virus, we are immune to it. This one, it works a little differently. It's what we would call passive immunization. So instead of inducing the immune response with a vaccine, we are actually essentially giving the immune response to the baby. So our bodies produce these little proteins called antibodies, which is a big part of our immune system that helps fight these infections off. And so what we're doing with these products in the infant is to just give them that antibody. And so it offers immediate protection as soon as they are immunized. And it lasts roughly 6+ months. That was kind of what was shown in the studies, probably a bit longer than that, but it takes the babies through respiratory season and it dramatically reduces the risk of hospitalization. Depending on the study you look at, somewhere between 80 and 95%.
Yeah, so that's what I was going to ask you next. And a quick aside, our audience knows this. If you are new here, welcome. I am pregnant. I am expecting my second. It's something I've been very candid about on the show. I will be taking the RSV vaccine during pregnancy, and I am so glad that we now have options, right, for people who want to take it during pregnancy or for babies after they're born. And it's something your pediatrician can definitely talk to you more about if you have questions. So quick aside, but what I wanted to ask you about, Sean, and I think you have started to allude to this, is how have these products changed what we see on the ground? Because I'll tell you, the experience of just one pediatrician here, I used to come in during winter season and clear my inbox of the notifications of all the babies who had landed in the hospital, which is a horrible thing to say, but I really would come in and say, okay, who was in the ER and or hospital for RSV over the past couple of days, right? And that has really changed. That has really, really changed. Again, just one pediatrician's experience, right? Tell us about the bigger picture, Sean.
Yeah. So this will be the third season, I believe these products are available. The first season, the availability was a little bit too late. And so we didn't see as much of a population level impact as we were hoping because of the timing of when they were licensed and approved and then shipped for use. RSV season kind of hit a little bit before. Last season, though, we did see good evidence of population level impact in much of the US. And there have been similar studies in other parts of the world, particularly in Europe, showing dramatic decreases at the population level from RSV hospitalizations, which is a really, really big deal.
Yeah, huge deal. And again, hoping that we can have the experience you had with rotavirus, right? And we no longer have to talk about RSV as fueling this winter sport that we call pediatrics. Now, Sean, let's move on to flu, if that's okay with you, because flu is a tricky one for me. I got to be honest with you. And I say that because flu has been around for so long and people feel so familiar with it. It's like people feel like they know the flu. And because of that, they almost like have no fear of it. So when it comes to children, give us the facts, Sean. How serious versus not is the flu?
Yeah, it's a really important question. Let me just start with a little to try and maybe dispel a little confusion. I think a lot of people call pretty much any illness that makes them sick the flu.
Right.
And so, oh yeah, I had the flu. And then you say, well, what did you have? Oh, I had a lot of vomiting and diarrhea. Well, that probably wasn't actually influenza. So, we use this term, the flu, pretty loosely, but what we're talking about specifically here is influenza. And influenza is a much more severe illness than most typical sort of upper respiratory infections. And it leads to many hospitalizations in both adults and children every year. Truly, tens of thousands of adults die from influenza in the US every single year. That number, fortunately, is much lower in kids, but it still happens. And I mean, this is kind of a hard thing to talk about as a pediatrician, but, we do unfortunately see pediatric deaths in our hospital. I think pretty much every children's hospital sees them every year. And the tragic thing is that almost all of those are preventable with this vaccine. Influenza, it causes typically, for an adult, for example, typically it's the high fever, the body aches, sometimes joint aches. You often have a sore throat, often can get a pretty severe cough. And that's a typical flu. What we worry more about is when you get into the complications. And those are things like pneumonia. In this last season, we unfortunately saw a higher rate of, or at least appeared to be a higher rate of a complication called encephalitis from influenza, which we see. It's a fairly uncommon complication, but we do see it, and it can be quite devastating. So flu, well, one, makes a lot of kids miss a lot of school, both in childcare and in school-age kids. It also puts a lot of kids in the hospital every year. And then it also puts a lot of kids in ICUs every year. And I want to just talk a little bit about the vaccine because there's a lot of sort of myths and misinformation out there. We see a lot of, in doing surveys and talking with families and things like that, we do hear a lot of reasons that, okay, why didn't I get the vaccine? One of the big ones is, well, the last time I got it, I got the flu. It gave me the flu. It doesn't actually give you the flu.
Right.
Now, some people can get some body aches. You might get a little fever, but that's not actually getting an active infection from the flu. For the most part, that's a sign that your immune system happens to be working pretty well that day, responding to the vaccine. And so then you're protected. Now, if you don't happen to have that reaction, it doesn't mean your immune system didn't work and you're not protected. It's just, that's kind of what's happening there is your immune system is responding to the vaccine. Some of the vaccines we give in the childhood schedule are close to 100% effective, meaning when we give it, they're not going to get the infection. Influenza is a bit different. It's a very good vaccine, but it's not a perfect vaccine in terms of prevention. Preventing respiratory illnesses with vaccines is particularly challenging for a variety of reasons, completely preventing them. We see that similarly with COVID. But what the influenza vaccine does very, very well is prevent complications. And so it's very effective at preventing hospitalizations, preventing ICU admissions. And that's true in both adults and children. And so even though it may not prevent you completely from getting a case of influenza, it is excellent at protecting you from getting hospitalized from influenza.
Yeah. And as someone, Sean, again, I share a lot with our audience. I got the flu, the actual real influenza, a couple seasons ago after having gotten a flu shot. And I'll tell you, I was miserable for a little bit, but I did not have to go to an emergency room. I did not have to go to the hospital. So I was grateful for myself seeing it work firsthand, right? And I'm also just so grateful for the number of patients that I'm able to keep out of the hospital. And I always counsel, just like you said, right? We may not be able to fully prevent you from getting influenza, although we hope to. But the point here is to keep you from landing in the emergency room, being hospitalized for several days. And that is remarkable in itself, right? Even though it's not perfect. Now, Sean, what is the official recommendation from the American Academy of Pediatrics when it comes to flu vaccines this season?
Sure. So let me start with the recommendations both from the American Academy of Pediatrics and the American College of Obstetricians and Gynecologists to get vaccinated during pregnancy.
Yes.
Because we know pregnancy is a high risk time for influenza infections and complications. But the other added benefit, this is one of those 2-for-1 things, getting vaccinated during pregnancy offers protection for the youngest infants. The recommendation for children is to start vaccinating against influenza at age 6 months. For the infants under 6 months of age, the hope is that they have protection from vaccination during pregnancy. And that's been shown in study after study to provide excellent protection for those younger infants who are too young to be vaccinated. So the recommendation for children is to start at age 6 months. The first season you get it, it's a 2-dose series, and that second dose actually matters. So you get a dose and then another one at least a month later. And that second dose offers additional protection. And then in subsequent seasons, if you've had your 2 doses, your recommendation is just to receive a single dose every season.
Yeah, and I will be taking that one as well. You bet I'll be taking that one. Sean, let's move on to COVID-19. And my first question to you is, how are you talking about the severity of COVID-19 in children? And I'm asking you this question because I think it has evolved a little bit, how we talk about it in children. So now with the hindsight of several years of data, how are you talking about the severity of it in children?
Sure. Let me just start by saying we are all so done with COVID, right? It was such a miserable time early in the pandemic. It lasted for quite a while where we had, the restrictions and sicknesses and illnesses and deaths, and it was terrible. And we just want to be past it. Unfortunately, it's still there. And it's still coming roughly with 2 peaks a year is what we're seeing now. And so I will say we are in a very different place than we were 5 or even 2 years ago in terms of the risk to children. So let me emphasize a few things. What we have seen in older children is that the risk of hospitalization in healthy kids has actually fallen quite a bit from where it was a few years ago. And that's due to a variety of factors, including vaccination, but also multiple infections. Because COVID comes, like I said, it circulates to an extent year round, but we see these waves sort of late summer, early fall, and then in the winter. And so people are getting COVID very often once or twice a year. So in these older kids, they've often had multiple infections. We do know that hybrid immunity, meaning vaccine plus prior infection, is probably better than one or the other on its own. And we also know that 90+% of school-age children have had COVID at least once. So our recommendation now for the older kids is if they're healthy, if they've previously been vaccinated, it's not a strong recommendation for those kids because their risk actually is relatively low. Now, I will put a caveat on that because, long COVID still happens and it happens in kids and adolescents. And there is reasonable evidence that vaccinating can prevent long COVID symptoms. The more important thing I want to emphasize, though, that I think a lot of people aren't aware of is that younger kids are actually at pretty high risk from COVID. And what do I mean by younger kids? So I'll break it up into a couple different groups. Under 6 months. And so the vaccination for children doesn't start till 6 months of age. So just like flu, the only way for them to be protected is to have mom get the vaccine during pregnancy. Those under 6-month-olds actually have a risk of hospitalization to this day similar to adults 65 to 74 years old.
Yeah.
So I don't think anyone argues that COVID is not severe in older adults, right? But people forget about these younger kids who are at high risk. Similarly, those kids 6 to 23 months of age have a hospitalization risk similar to adults 50 to 64 years of age. Okay, so relatively high. And so that's why the American Academy of Pediatrics recommends, as a routine recommendation, COVID vaccination for infants 6 to 23 months of age.
And when you're talking, Sean, about older kids, what you mean is beyond 23 months of age?
Correct. Yeah. The risk drops quite a bit starting at age 2, falls even further as you get older in terms of hospitalization. Now, the other couple things I want to mention about that, there are a lot of kids that have high risk conditions, and those kids do remain at relatively high risk of disease, asthma being a very common one that I think pretty much any child with asthma should do everything they can to protect themselves from respiratory viruses, including COVID and influenza. But there are other conditions as well. The most concerning, of course, are the immunocompromising conditions. And those are like, for example, kids going through treatment for cancers and things like that. Relatively uncommon, but they can suffer from severe COVID. And then, of course, many families have vulnerable people in the household. That might be someone in the family who's pregnant.
Right.
That might be someone in the family who has an immunocompromising condition. That might be a grandparent the child spends a lot of time with. So there are lots of other reasons to get vaccinated beyond these high-risk conditions.
Yeah. And that was going to be my next question to you, right? For those of us who have kids who are in the quote unquote older, 2 years old and up, how do we think about them? And I think just really thinking through those high risk conditions and knowing that the COVID-19 vaccine is safe, right? Making that decision in a way that is informed by our circumstances. My child has had it every season. He had it since I was pregnant. And my 4-year-old, Sean, I'm catching you up because our audience has been sort of along with me on this journey, but I'm catching you up. My 4-year-old has been vaccinated since I was pregnant. And now we will be trying to get vaccinated again this season. I say we'll be trying to get vaccinated again this season because I have a couple things to ask you about, Sean. Vaccines have been in the news a lot lately, as you know. And one of the things that have happened is that there's been conflicting information being promoted about the schedules. The FDA and the CDC have changed their COVID-19 vaccine schedule in a way that contradicts the American Academy of Pediatrics recommendations and many other leading medical authorities. We also see that many states are starting to release their own immunization schedules that differ from the federal government's. So for people who are sort of listening to you, understanding risk, understanding recommendations, but at the same time are seeing that these recommendations coming from the federal government are starting to differ, what advice do you have and how do you get the best information?
Yeah, we are in a tough time right now. I think it is probably incredibly confusing for parents hearing different things from different organizations, and from the federal government. So just as background, the main body that makes vaccine recommendations historically for the United States is called the Advisory Committee on Immunization Practices. And unfortunately, recently, 17 members of ACIP who were really experts in the field were all fired. And now on this committee are a number of people who are frankly anti-vaccine and anti-science and are spreading a lot of conspiracy theories and things like that about COVID vaccines. And it's really honestly kind of tragic what's happening. What I can say is that the medical and public health communities are very much aligned in we want to support the health of the American people. And from the perspective of the American Academy of Pediatrics, our goal is to promote the health of children. And that is what we are going to do. And so that's how we landed on the recommendations based on the best available science and evidence. Unfortunately, what's happening at the federal level is making it more challenging for a lot of people to get vaccinated. And I don't want to sugarcoat this. I think it may be difficult to find a place to get vaccinated this next season, particularly for kids, but we're doing our best.
Right. So that was exactly what I wanted to ask you, right? Like, how is this going to impact the ability of parents to get their kids vaccinated? And will these vaccines, the COVID-19 vaccine in particular, which is where the recommendations have differed so far, will they still be covered by insurance? Do we have any information, Sean?
Yeah, that's a really important question. So the American Academy of Pediatrics and other professional societies have been working closely with the payers, with the insurance companies, and we have been getting assurances that they would cover this. Now, a lot of these things are happening on a state-by-state basis, and some states have already, as you mentioned, taken things into their own hands. And so some states, for example, are requiring that the payers in their state pay for these vaccines. But it's going to be on a state-by-state issue in terms of how that works.
I, to be honest with you, Sean, didn't even know that this could go down to the states. I'm learning that that is a possibility because we just haven't had this issue come up in this way before. So here we are.
Yeah, I mean, it's a pretty dynamic, evolving situation. And honestly, by the time this airs, things may be different.
Right. Sean, a few weeks before this recording, we also saw an announcement from the state of Florida that they're moving to do away with childhood vaccine requirements. This, meaning vaccine mandates in general, have been in place in this country with minor variations in all states, right, for decades. So what is your take on why this is happening and what the effect will be for public health if this does in fact move forward?
Yeah, I mean, the why piece is complicated, and I don't want to get into too much detail there, but it's really, unfortunately, this situation of just the kind of the very insidious spread of sort of an anti-science mindset among certain leaders. And so that's what we're seeing happening in Florida is the promotion of conspiracy theories and sort of anti-science rhetoric. So the reason we have requirements for vaccines in school is to keep our kids safe and to keep them healthy and to keep them attending school. There are very good reasons that we have chosen to do this as a society over the many decades. And frankly, most parents actually support that. They want to be able to send their kids to school. Parents have plenty to worry about these days. They don't want to have to be worrying about their kid getting measles or pertussis or one of these other dreadful diseases at school.
Right.
And so just like all the other safety procedures that schools undertake to do their best to keep our kids safe, that's what these vaccine requirements are about. And we also know that these vaccine requirements work to maintain very high vaccination coverage. So unfortunately, if we do see more states roll these back, what we will inevitably see is more of these diseases, in some cases, diseases we haven't even heard of for decades.
Right. It's actually pretty simple math, right? We roll this back and we will start to see very likely some of these diseases. It's daunting, to say the least. That is the best word that I can come up with right now. It is daunting. Now, Sean, as we come to the end of our episode, we like to end with what we call a parenting prescription. So when it comes to staying healthy this fall and winter, what is one thing you want all parents to remember?
Gosh, I think going back to something we probably all learned when we were in kindergarten, an ounce of prevention is worth a pound of cure. Get those vaccines and you have one less thing to worry about.
Love it. Couldn't have said it better. Thank you so much, Dr. Sean O'Leary, for joining us today.
Thank you.
And thank you at home for joining us. If you like the Healthy Children podcast, please subscribe on your favorite podcast app and help us spread the word. Follow Healthy Children on YouTube, Instagram, Facebook, and Threads at Healthy Children AAP. And be sure to visit healthychildren.org, the parenting website of the American Academy of Pediatrics. Healthy Children is a production of the American Academy of Pediatrics. Our creative team includes
Laura Alessio,
Catherine Beard,
Garrett Brown,
Zach Christman,
Ann Johnsos,
Kathy Jewell,
Claire Keating,
Doug Nagel,
Jackie Ortega,
Susan Stevens Martin,
Mary Claire Walsh,
Hannah Weston.
And our theme music was composed by Doug Nagel. We'll be back next week. I'm Dr. Edith Bracho-Sanchez. Thanks for listening.